Test-taking strategies. Test anxiety will produce tension and stress before, during, and after the examination. It can actually block the student's ability to think, and it can cause poor outcomes. The student may have difficulty concentrating and focusing when taking an examination, and the student may also experience physical symptoms such as a stomach ache, nausea, vomiting, and/or diarrhea. Different ways to help prevent and reduce test anxiety can include managing your time well, developing those good study habits. Don't put off studying for a test until the last minute. Practice those relaxation techniques that we went over in your time management and stress reduction lecture. Develop good test-taking skills. Begin reviewing these strategies and adopting some of these skills. And we also recommend taking practice test questions and clarifying any weak areas with your instructor. But most important, remember that you know this information, and don't let your anxiety rob you of a good score. Okay, so let's start talking about some different strategies when taking a test. Some different things that you need to know. First of all, eliminate those distractions. Again, maybe some foam earplugs. Maybe you need to cover the answers of the question while you read the question until you actually figure out what the question is asking. Some people read very quickly, and you may need to slow down your reading by using a pencil or a pen or your finger to follow along with the words to help guide your eye. By covering the answers, you prevent yourself from subconsciously reading ahead and I can't think of the word I want. When you read ahead, you can actually pull some of those words from the answers, and it may cause you to choose the wrong answer. So covering up those answers sometimes is really a good idea. Being able to effectively apply test-taking strategies on an examination is almost as important as having the basic knowledge required to answer that question. Nursing education is going to provide you, the student, with a comprehensive base of knowledge. The exams determine how effectively you can demonstrate this knowledge. Unfortunately, nursing school is all about the examinations, because to receive your license, you have to pass a national examination. Examinations at the PN level are a combination of knowledge questions, where you regurgitate the information, in other words, you memorize it and you spit it back out, and application questions, where you take your knowledge and you are able to apply it in a clinical situation. Your examination is going to evaluate a minimum level of competency. It will determine if you have the knowledge, the skills, and the ability required for safe and effective entry-level nursing practice. These exams are based on textbook practices, but not necessarily on the real world. Some questions are going to require critical thinking skills to determine the correct answer. Remember that critical thinking skills require an evaluation and an interpretation of client data, an understanding of the client's condition or disease, and the ability to determine the best action that will most effectively meet those clients' needs. We look at the nursing school hospital. With your tests, remember the nursing school hospital is the ideal environment. You're going to have adequate staffing, adequate equipment, adequate supplies, etc., to be able to provide the safest care for the client. and assume that the clients will respond as the textbooks indicate that they will. If a question asks you to call the doctor or anyone else, be cautious about passing the responsibility for care of the client to someone else. The examination that you are taking is an examination of nursing care. So evaluate the question carefully and see what nursing action should be taken for consulting or calling someone else. If the nurse cannot do anything to resolve the question, then calling for assistance may be the best answer. When you look at doctor's orders, it's always assumed that a doctor's order is available to provide the nursing care in the answer options that are provided. If the question asks for the administration of a specific medication for the client's problem, then you must assume that there is an order for it. Focus on the client. Look for answers that focus on the client, not on the hospital or the rules or the policies or the equipment. Evaluate the status of the client first. Provide for client safety. Then you deal with the equipment problems or concerns. Some questions might ask for a response to a family member or a significant other, so make sure that you determine who the question is directed to. Look at the client's age. Consider a client to be an adult unless it's otherwise stated. The words elder or geriatric are not commonly used. Rather, the words older adult are used to denote an older client. Laboratory values. It is important to know the normal values of common labs for common lab tests and/or diagnostic procedures. Client positions. If a specific position appears in the stem of a question, consider whether the position is for comfort, whether it's for treatment, or whether it's used to prevent a complication. What is to be accomplished by placing the client in the position, and why is that position important for this client? And mathematical computations. They may be included in the calculations of medication dosages, the conversion of units of measurements, as well as the calculation of intake and output. Be able to apply the appropriate formula. A basic calculator will be provided as necessary. You will not be allowed to use scientific calculators or phone calculators. Do not round any answers until your final computation. Tips for test-taking success mean that you should never indiscriminately change your answers. Some instructors have taken the ability for you to go back to previous questions, but if you change an answer, you should only do so if you have a specific reason. Sometimes you're going to remember information and realize that you answered the question incorrectly. Then you can go back and change that answer. Or sometimes a subsequent question will provide additional information and you realize that a previous question was answered incorrectly. Otherwise, do not second guess yourself, because usually your first guess or your first thought is correct. Watch your timing. Evaluate timing on practice exams. Try not to spend more than 1 minute on each question. Eliminate all the options that you can and pick your best choice. Move on to the next question if you're struggling with one question, unless your instructor has disabled the ability for you to backtrack. Remember, on NCLEX, you will not be able to backtrack, so you have to answer each question as you come to it. Nursing tests are basically nursing competency examinations. The correct answer will focus on nursing knowledge and the provision of nursing care. Medical management is not the focus of the test. Eliminate the distractors in the question. Eliminate responses that assume the client would not understand or would be ignorant of the situation, and eliminate responses that indicate the nurse needs to protect the client from worry. Realize that there is no pattern of correct answers. Computerized tests generally and most often will have the answers randomly mixed up. And when you're sitting down to a computerized test next to another student, their test questions are not going to come up in the same order, and the answers are not going to be provided in the same order as yours are. Again, be sure that you have answered all the questions prior to submitting the test. Make sure that you have chosen the answer that you wanted to choose and that you did not accidentally push the wrong button. When you manage client care, keep in mind that the majority of the areas where LPNs have charge nurse duties are going to be in long-term care facilities. LPNs can direct the care provided by nursing assistants or other LPNs. LPNs will be under the supervision of an RN. Pay attention to the nursing action the question is focusing on and to whom the nurse is assigning the care or nursing activity. Is it to a CNA or another LPN? Keep in mind the nursing school hospital. Remember, there is adequate staff to provide the care in the question. The only client to consider in each question is the client involved in that question. You may need to identify the most stable client. The most stable client will be the one that has the most predictable outcome and is least likely to have abrupt changes in condition that would require critical nursing judgments. Look at Maslow's hierarchy of needs when you're considering the stability of a client. The most stable client is often the one whose care can be delegated to a nursing assistant. When assigning tasks, assign tasks that have specific guidelines. Tasks that have unchanging guidelines and are used in the care of a stable client, again, are the ones that often can be assigned to a nursing assistant. Identify your priority client. The priority client is the one most likely to experience problems or ill effects if they are not taken care of first. Unstable or changing conditions will have priority, and those at an increased risk for developing complications. Carefully read the question. Determine which clients are in a changing, unstable situation. There are clients that may require notifying the RN or the physician, but you need to ask, can the LPN meet the client needs? And when making client care assignments, make assignments to those caregivers who are emotionally prepared, experienced, and most capable of caring for the client. CNAs or unlicensed care providers will require direct supervision from the LPN or RN. When establishing nursing priorities, again, look at Maslow's hierarchy of needs. Physiological versus psychosocial. Physiological needs should be cared for before psychosocial. Just an FYI, pain is considered to be a psychosocial need according to NCLEX. So if a client is having pain in a test question, that would not have a higher priority over a physical need. Remember your ABCs or your CAB. Circulation, airway, and breathing are the most critical physiological needs. And don't read into a question. Just because the word airway is an answer option does not necessarily mean that it's the correct answer. Remember that you will establish your priorities by following the nursing process. Assessment always has to come before intervention or diagnosis, etc. Assessment will be your data collection. If you have a changing client status in a question, assessment is going to be what you do first. Nursing diagnosis: analyze the data to determine the problem. Planning utilizes Maslow's hierarchy to help determine the best nursing action. Implementation, evaluation. Again, if a nursing action has been implemented, you have to determine if the question is evaluating the question. Safety issues. First, look to see if the basic needs for survival are being met. Again, your oxygen, nutrition, and elimination. And then reduce environmental hazards. Prevent falls, accidents, prevent spread of disease, and medication errors. Determine what answer option will be of the most benefit to the client. Then you have to begin looking for keywords. There's frequently going to be more than one answer that's correct, and you are going to have to choose the best answer. So some of the keywords are early or late, best, first, initial, immediately, most likely or least likely, most appropriate or least appropriate. When asked what is an early or late sign or symptom of something, then you're going to be needing to remember your pathophys. Example: what is an early sign of hypovolemia? Or what is a late sign? Etc. When you see the word best, what is the best intervention? What is the best answer? You're going to have some similar options provided. Use that nursing process and realize that there probably is more than one correct answer. When you see first, again, remember that nursing process. Initial. These questions are similar to first. Immediately. What is the first thing you're going to see? Again, very similar verbiage, but know what it's asking for. Most likely or least likely. These questions are more about what you might see or hear regarding what is happening with the client. What would you most likely expect the patient to do or least likely expect the physician to order? The most appropriate or least appropriate are questions that are related to communications and interactions, as well as some interventions. It is important for you to remember to avoid answers that have the words always, never, must, all, or none, because those really limit you. Some questions are going to ask you to prioritize an intervention, and you'll need to prioritize when you see words such as best, essential, first, highest priority, immediate, most important, etc. Don't forget to use your Maslow's hierarchy of needs and your basic CPR, CABs, or ABCs. Look for similar options. Now, not always, but a lot of times your similar options are going to be incorrect. If any of the questions or any of the options have the same ideas, they are most likely incorrect and can be eliminated, but I'm not going to say that always happens. Remember that there is only one correct answer, and usually the answer is the option that is going to be different. Focus on what the question is asking. For example, the client is at risk for excess fluid volume. Think about the pathophysiology that's associated with each condition identified in the options that are presented. The client retains fluid is the client that's going to have renal failure. The client that has an ileostomy and is taking diuretics is going to be the client that will be losing fluids. So you need to know that pathophys. Now, I'm not going to go through all of these questions. These are things that you can go through on your own, but we'll go through a couple. When you read the question, be careful to look for and consider all of the options, and do not read extra meaning into the question. A bronchoscopy was performed on a client at 7 a.m. The client returns to his room and the nurse plans to assist him with his morning care. The client refuses the morning care. What is the best nursing action regarding the client? So before you even look at the options, what is your question asking? Well, it's asking what is the best nursing action regarding this client who received a bronchoscopy at 7 that morning, and the nurse is wanting to complete morning care on. So now you look at your options. Perform all of his morning care to prevent him from becoming short of breath. Avoid morning care and continue to monitor vital signs and assess swallowing reflexes. Postpone morning care until the client is more comfortable and can participate. Cancel all morning care because it is not necessary to perform it after a bronchoscopy. Again, don't read extra meaning into the question. Don't ask what if or the client might. If it appears to be common sense, it probably is. So, should you perform all of the morning care for a client? Well, we encourage our clients to do what they can for themselves, and then we assist them with what they are unable to complete. Should you avoid morning care and continue to monitor vital signs and assess swallowing reflexes? Well, you need to continue to monitor vital signs, and you need to continue to assess swallowing reflexes, but what does that have to do with morning care? Should you postpone the morning care until the client is more comfortable and can participate? Well, this seems like a pretty viable option here. Postponing it until the client is able to assist you does seem very appropriate, but let's look at the last one. Cancel all morning care because it's not necessary to perform it after a bronchoscopy. Should we cancel something just because they've had a procedure? Probably not. We're talking about brushing our teeth and washing our face. Those are things that should be done on a daily basis. So canceling that morning care is probably not going to be your best option. So actually C would be the appropriate response. So you also need to read the stem of the question correctly. You may need to rephrase the question. This question states the nurse is discussing body mechanics with a client who has had back surgery. What nursing observations would indicate the client did not understand the principles discussed? Rephrase the question. What is the client doing wrong regarding body mechanics? So you've determined what the question is asking. Now look at your answer choices. The correct answer is D. I'm going to let you go through the rest of these questions yourself. If you have any questions on what these slides are saying, please bring that to the attention of your instructor. Also understand that your PN NCLEX review books, your student planner, and a variety of other sources do give you information on taking tests and tips for test-taking strategies. I also highly recommend that you save this lecture. that you download it so you can refer to it again and again as you go through your nursing career, because you will tend to forget some of this information when you're taking your nursing examinations.